Hey, so today I'm going to be talking about the urethroplasty surgery. The topics that I'm going to cover are: what is a urethroplasty surgery, what are the signs and symptoms of urethral stricture, what are the types of urethroplasty, how does a recovery and follow-up care look after a urethroplasty surgery, how to select your surgeon and hospital for this surgery, what is the cost of urethroplasty surgery in India, and why to come to India for this surgery. What is a urethroplasty? Urethroplasty is a surgery to correct the defect in the walls of the urethra. Urethra is a tube that carries the urine from the bladder to the outside of the body. Any blockage or fibrosis in that tube is called a urethral stricture, and the surgery to remove that stricture and correct the tube is called as the urethroplasty surgery. What are the symptoms of the urethral stricture? The symptoms could be mild to moderate to severe. They are basically in the form of difficulty to pass the urine, incomplete evacuation of the bladder, very slow passage of the urine, repeated urination in the night, frequent urine infections, and sometimes a little discomfort in the abdomen. These are the common symptoms of a urethral stricture. What are the types of urethroplasty? For matters of simplification, I will just name the different types of urethroplasty as of now. They are penile urethroplasty, bulbar urethroplasty, penobulbar urethroplasty, penile flap urethroplasty, buccal mucosa graft urethroplasty, posterior urethroplasty, staged urethroplasty. How is the recovery and the follow-up care after a urethroplasty surgery? During the surgery, a catheter would be inserted and it would be removed 2 to 3 weeks following the surgery. This would be done by the surgeon himself. It would be important to avoid any kind of strenuous activity and exercise for these 2 to 3 weeks, and even after removing the catheter, this has to be avoided for some time. Sexual activity also has to be avoided for 6 to 8 weeks. Urethroplasty procedures usually have a high recurrence of urethral stricture, and so follow-up under your urologist is very, very important. The surgeon will keep on observing you and will advise you follow-up care depending on how you go ahead with the long-term recovery. How to select the best surgeon and hospital for your urethroplasty surgery? When you talk about the surgeon, make sure that the surgeon is trained from a very good institute, is very well experienced, and has a large number of credit for these similar procedures. For the hospital, make sure that the hospital is a big brand, reputable, and has all the good infrastructure and support services, trained medical staff to handle all kinds of surgery and emergency conditions. What is the cost of urethroplasty surgery in India? The cost is dependent on the seniority and the experience of the surgeon, what is the success rate of the surgeon, what is the brand reputation of the hospital, how good is the hospital, how well equipped it is, what is the training of the medical staff, and the patient's factors dependent are what is the kind of urethroplasty required and how bad was the patient's condition to begin with. So these are the important factors that will determine the cost of urethroplasty surgery. Why to select India for your urethroplasty surgery? See, there are many reasons, but the most important ones are: the surgeons are really good, well experienced, well trained. The results are very good. The hospitals are very good, well equipped, well trained staff. Plus, India has very good logistics and support services for the patients, very good English and multilingual speaking staff. So these are some of the common reasons why a lot of international patients come to India for the surgery. I hope I have covered all the important information that you wanted for a urethroplasty surgery. If you or any of your known ones are looking for a similar procedure, any urology surgery in India, please feel free to connect them with us. We will be very happy to guide them. Thank you.